Okay, so a very good afternoon, good evening to everyone present in this call. I'm Dyutika. I'm from the team of Know Your Calling, an initiative started by Dr. Dharia. And our aim is to provide guidance and about all the fields available to postgraduates and for super specialization as well. And today we are pleased to have Dr. Akshay Yadav with us, who has completed his M.D Anesthesiology at LTMMC Sion Hospital in Bombay, and is currently a senior resident pursuing a DNB in the Critical Care Medicine Department at JAslok Hospital in Mumbai. We are honored to have you here today with us, sir, and we thank you for taking out your time and your efforts to be here with us, sir. Thank you.
Yeah, good evening, everyone, and thank you, KYC, for giving me this opportunity. And I have been associated with KYC initially, long back in 2022 as well. And they are doing an extremely good job by solving these doubts for the medical students, medical professionals, junior doctors, and extremely noble thing which they are doing. So thank you so much, KYC. So I think we can, without wasting much time, we will proceed with the today's session. And over to you. Uh,
Yes. So
let's.
yeah, without any further delays, the first question that I think everyone wants to know, what is critical care medicine? Can you provide a general overview of this branch as a super specialty?
Yeah. So critical care medicine is a emerging branch, I would say. See, we all know that there are certain specialties which are coming recently, and critical care medicine is one of them, which deals basically with the life-threatening diseases
Mhm.
and organ support systems, and there are various machines involved in critical care. And also we can say that invasive monitoring is there, transplant management part is there. So you should have that passion to treat the patients in critical care medicine. And as my seniors and we discuss that every second matters in critical care, because if you are not preparing for the worst, then the worst will happen, is
No.
what they say. So yeah, that is the thing. So that is a brief intro to the critical care.
Okay, so it's a very high stakes situation then. So when it comes to choosing it, so which are the primary specialties that would be eligible to pursue a DM or a DNB in critical care medicine?
So as per the recent notification released by the NBE, it is quite evident that specialties like general medicine, anesthesia, then pediatricians are also eligible to opt for this. Then respiratory medicine, I am having so many colleagues, and one the director of my institute is also from respiratory medicine department. Then we also have emergency medicine, which the MD in emergency medicine. So any MD or DNB in these five specialties which I have mentioned are eligible to give this critical care exam. So if there are 6 central institutes for which INI conducts a different exam. Otherwise, all other institutes, we have NEET SS, which was recently conducted on 29th March, and the aspirants are here with us. So all these 5 specialties can opt for that, and it's very good that this time they have made a special exam for critical care, because last year and last year it was very difficult, because they have kept it in medical group, and other specialties were finding it difficult to qualify the exam, because they were
Mhm.
competing with the medical people there in their own specialty. But then this time NB has taken a very good decision, and we are seeing the results, and definitely the critical care medicine seats will be available for all.
Okay, perfect. So, and also when it comes to other pathways, are there like any other recognized alternative pathways such as fellowships or diploma programs for training in this field specifically?
See, fellowships, yeah, fellowships are available. Like Indian Society of Critical Care Medicine offers this IDCCM and IFCCM. So this diploma and fellowship courses are there. and they have very good training modules also. But then in the upcoming years, maybe we can discuss it afterwards when we are discussing the future of this specialty. So in the upcoming years, it is said that DNB and degree holders will be having more values. But yeah, sometimes people don't have that those critical 3 years which they can give for their super specialty. Then definitely they can go through IDCCM, IFCCM, or if in any other country they want, they can do the fellowship of that particular country. Also, the international fellowships like IDEC, if they are doing that and along with IDCCM, then they are having a good opportunity. But
Okay.
everything is questionable in the upcoming 5 to 10 years when there will be a lot many number of degree holders, because this is a new emerging branch, and degree DM as well as DRNB was started recently in 4 to 5 years. So there will be a lot many degree holders in upcoming 5 to 10 years.
Okay, interesting. Okay. So when it comes to how you go about your day, like how is your life in as a critical care medicine resident? How is a day in your life? How through your lens?
Yeah, so that's a very interesting question. So we usually have this 8 hour shift or 12 hour shift in any ICU. And see, there are different things, different routine if we compare the DM resident or DRNB resident. Let me first clarify what are the differences between DM resident and DRNB resident. DM resident are generally in the government setup, and they do have a proper schedule. But then sometimes in the government setups, you are under the control of your department. I would say frankly, in DNB it's not like that. Yeah, department plays a role, but sometimes
Hello. Mm, I'm sorry. I'm just going to text him really quick. Yeah. Hello.
hello.
Yes.
Yeah,
Sorry.
I think something was wrong. Yeah.
You got the last point you said was about DNB.
Yeah, so I was comparing DM and DRNB. So
Yes.
yeah, we have lesser seats of DM compared to DNB. Like there might be 60 or 70 DM seats and approximately 400 DRNB seats. But then yeah, in the government setup, entirely the life is different and the exposure is different. The setup infrastructure is different. While in DRB, NB is generally there in the private hospitals. Nowadays, it is also there in government setups, but the government setups are going more towards DM. So there, the setup is different. The facilities of labs, infrastructure are different in government, and they are lesser in government. I would say. In DM, the passing rate is more. In DNB, we would say the clinical exposure is better. Yeah, in DM we have bond. In DRNB we have theses, which is not there in DM in most of the cases.
Mhm.
In DM also bond is there in specific states, I would say. So this is the basic difference which I told between a DM and DRNB resident. Now we will move towards the daily routine, the main question which you have asked. So we are generally having this routine or a shift of 8 hours or 12 hours, but there is a buffer time, the overlap time. Like in the
Mm.
8 hour shift, you will have 1 to 2 hours of overlap, and in the 12 hour shift, you might have 3 to 4 hours of overlap. So that you have to count. But most of the institutes, they give 24 hours gap. It depends on the institute. Like in my institute, they generally give minimum 24 hours of gap between the two shifts, so that your brain can function well in the next duty, and your health is taken care of. Then
Okay.
I usually say and discuss with the staff here that while charting or while monitoring the intake and output of your patients, you should also take care of your intake and output, and you should not miss, because ultimately that will take a hit in the upcoming years of residency. But you should take care of yourself. Yeah, definitely. Sometimes it happens that lunch we take as the breakfast we take as lunch at around 12 o'clock or 1 o'clock, and the lunch is at 4 o'clock. Sometimes you have to skip dinners. Yeah, it happens in this branch. But then you should take care of yourself. And then in the clinical exposure, if I talk, so we get to see various machines like ECMO, IABP. Then you have to handle sensitive things like organ donor management is there, brain death certification is there, then intra-hospital and inter-hospital transfers are there, air ambulances, intensivists are involved. There are various cuttings which you get. Cuttings is the word which most of the residents use, like lines you get, HD ports, TPM placement, then tracheostomy, ICD, bronchoscopy, various interventional as well as diagnostic things you get. POCUS is the bread and butter, I would say. POCUS, which means point of care, ultrasonography. Then cardiac monitoring, then ICP monitoring. So various monitoring aspects are there in the life of a resident doctor. And sepsis, we all say, is the main thing for intensivists. We have to manage sepsis properly. So all these clinical exposures I have taken into like I've discussed. Then you should be having good communication skills. You should be able to tackle with the relatives very nicely, because at this like in critical care, the patients are at on the verge of their there are life threatening diseases, so they are on the verge of their what we say is they are in the end stage of stages, most of the patients end stages of their life. So all these things I've just given a broader perspective. I know I've slightly I've not answered the proper thing, and I've added few more things because I wanted to discuss that thing too. Yeah.
No, but you did cover like how your shifts go, and then also, like you said, we tend to take our body for granted, don't eat and
Yeah.
sleep properly, and then it takes a toll on us in later years. And well, but it's good to know your experience and what you go through and what are the differences as well. Now you've clarified the differences between a DM and a DNB. So coming to how you chose this branch. So what was your motivation to choose this branch, and what inspired you to choose this over other subspecialties?
Uh, so Back in 2007, I would say there was one of my close relative who had heart attack in front of my eyes, and there was nothing to do. We were not aware of CPR in those days, and there were processions, religious processions going on. I couldn't take my close relative to the nearby hospital at time, and uh, that relative succumbed to death. That time I decided that yes, I will choose medical profession. Then in internship, I realized that critical care is the only branch, because whenever in OT or anywhere, any patient used to have that critical condition.
Mm-hmm.
So intensivists were the one who used to come first, and they were like everything for that patient at that particular time.
Right.
So in internship, I got that motivation that yes, I have to choose this branch in my future life. And since PG days, I was prepared, I was well prepared for the this branch, and I was going through I was trying to search for literatures and what all things I would get to know in this branch. So that passion to have to treat the patient and the real time impact which you get, the sense of satisfaction which you get after a 12 hours or 14 hours long shift. So that is the thing which drives us to continue more in this branch. And yeah, you get a sense of leadership, this is a multidisciplinary approach, critical care medicine. So various specialties are involved, so you are kind of leader in those specialties, and you try to you should be calm enough, and you should be devoid of ego. You should take their advices and you should do whatever best is there, whatever is best for the patient. So in this way, all these things are there. Multiple cases I have seen, like in my residency in critical care, when we said goodbye to a heart transplant patient, that moment was very special. Or maybe a 15 years old girl was saved by a rapid intervention when she had reaction to a deadly reaction to FFP, fresh frozen plasma. So all these things matter, and these are the what we say motivating things which motivate all of us to continue and pursue the branch.
Wow.
Uh,
So, well, yeah, well, that was very inspirational, and also a personal touch definitely motivates you throughout your journey. So it's inspiring to know that personal stories like that still continue to boost your energy and interest in the branch. So, but as we know, like not everything is good, and there has to always be a balance of good and bad. So, what are some of the challenges that are associated with this branch, and how do they impact you in your life, your health, and your career progression?
yeah, so main challenge I would say is the emotional burst out. You should
Mm,
be like very tolerant. It's not just that it happens in your academic or clinical life, but then you tend to bring those emotional bursts outs in front of your family members and your partner. So I always say that supportive partner and supportive family member is the key towards success of a critical care specialist, because they if they are supported, definitely you will achieve bigger goals in critical care branch. Because what happens is you are dealing with patients who are most of the patients are towards the end of their life, and in those stages the relatives, when they try to question each and every decision of yours, whatever, even if you're doing for the betterment of the patients, they try to shout more on you. You should be very calm enough to tackle that. And as I said earlier, in the life of a resident doctor, that question section I have mentioned, that you tend to ignore your own physical health. The what we say, the circadian rhythm is disturbed because you are having night shifts, even in the age of 40 years. You are sometimes, if you are not in government setup where you get promotions, so definitely you will be having night shifts. And those night shifts are not like I see, I'm not demotivating the other branches, but then yes, in critical care, if you're there for 12 hours, you are there for 12 hours. It's not that you can take rest for 1 hour or maybe even 15 minutes in the night shifts. Sometimes yes, you get time, but then many of the times you're busy in doing something, because maybe in cardiac ICU some patient may go into atrial fibrillation, maybe in neuro ICU the EVD drainage has decreased, and you need to inform the neurosurgeon, and we need to take the patient to OR. Then sometimes everything is going well, and some of the patients, they are just having random tachycardias, they are having decreased urine output. You need to know what's wrong with the patient, you need to act fast. So it's full of ups and downs, and that affects your health, mental as well as physical health, and you are exhausted towards the end of your shift. So that is their long working hours. Yeah, every resident has that. So I would not say that this is something special challenge which you are having in this branch. But then, yeah, long working hours. Mainly the night shifts might affect you
mm,
even after your residency, I would say. And yeah, so you're constantly dealing with patients who are critically ill, so that affects your emotional well-being. So
mm,
you should be emotionally sound to tackle all these situations, and the family members of the patient, sometimes
mm.
the patient also. Otherwise, there are legal implications nowadays, we all know. So yeah.
So, well, as you mentioned, like it's such a high stakes job. So, if I were in your place, I would definitely need like some sort of therapy, and I guess that comes from your parents or your spouse. And I'm grateful for doctors like you who continue to serve people who need help. And so when it comes to the institute, when you chose your institute, for instance, what should an aspirant look for while they're selecting a college for critical care medicine in specific? And how
Yeah,
does
so
yeah, and how does the infrastructure, caseload, how does it affect training quality?
I would say in the entire discussion, this is one of the very much important and very important question which you have put forth, and I would like to take some extra few minutes for this question to answer, because mainly when the counseling starts, this is the main question. Because see, you have already chosen the super specialty when you are giving that particular group in the
Yeah.
NEET SS. But then, which college to choose is the main question. So, as you said, infrastructure, yeah, it definitely matters. There should be presence of machines like ECMO machine, CRRT machine, IABP machine in your institute. There should be modern monitoring machines, cardiac output monitoring machines. Then hands-on, good hands-on ultrasonography machine should be available. Focus, as I said, is the main thing which you do and which can give you lot many information about the patient who are critically ill. Then yeah I would say that varied clinical exposure, like see, in tier 1 cities you will get cases which are of very high level, high level as in you need more knowledge to deal with those cases, because we see rarest of the rarest things in tier 1 cities, and anomalies, genetic anomalies. We don't know why the patient is reacting like this, and I would say you get that feeling of house MD when you are solving these intricately complicated cases in tier 1 cities. So that exposure should be there. Poisoning cases, transplant cases, subspecialty cases like neuro, cardiac, and then these varied clinical exposure should be there in your institute. I'm grateful that my institute is having that. And then you should be having rotation among different ICUs. Like if you should not be posted in the same ICU with same cases throughout your entire 3 years. Like we have rotation in our ICUs, and I get to see all the cases, may it be septic cases, may it be surgery cases, medicine cases, cardiac, neuro, everything. And then there should be I think in the DNB there's a mandatory thing that 6 months of ward postings are there for the critical care branch, in which you get to know about like 1 month posting is there in general medicine ward, 1 month posting is there in cardio ward, and you do get to see more ecos in the cardiac posting. Then how the nephrologists are prescribing dialysis for the patients, you get to see in the nephro posting. So in my institute I have this, and I get to know like in other institutes basically who are basically where DrNB degrees are being DrNB trainees are there. In those institute NB has mandated, and that is why this 6 months of extra touch, and you get to answer properly in Viva, because you know more on the subjects those specialties in these 6 months. So this is very important. You should take like question the institute, the DrNB trainees of those institutes, that are they having those extra 6 months of ward postings. Then regular academics is the key. Like in my institute we have every week at least one offline and at least one online lecture. We cover journal clubs, we have case presentations, we have seminars. Then apart from this, we also get to know we also get to enroll in other online meetings or seminar webinars where my consultants are there, or they are giving the lecture. Also in online webinars of other specialties like cardio or nephro, because sometimes you need to know their perspective, how they are thinking about that case.
Mhm.
Then yeah, also NB has this web Webex or something webinars regularly for all the DRNB trainees. So that also helps you. Then you should be having consultants in your department from different specialties. Like I'm lucky to have consultants from different fields. When I say this, I mean that in the critical care department, you should be having consultants from respi medicine, from anesthesia background, from medicine background, from emergency medicine background. So what happens is they try to give you their own perspective and how a medicine passed out will look this case, how anesthesia passed out will look this case. So you get to learn about the subject in a very better way if your department is having that. And then I personally feel that there is a concept of open and closed ICU, semi-open, semi-closed, whatever. So closed ICU means that only your department will take the decisions of the patients. And open ICU means that, yeah, the consultants under whom that patient is admitted, they will interfere. So I personally think that entirely closed ICU won't help you, because what happens is when you're having open ICUs, so you get to learn the perspective of cardiologist in a complete hard block place, which I'm not saying that your consultant won't be knowing, but that extra what we say cherry on the cake, as we say, or the brownie points about that particular case, you get to know. Or when other field consultants are involved. So as I said, it is a multidisciplinary approach. Then yeah, you should also when you're choosing the institute, you should look for the work-life balance. How many leaves are you getting? Like in DNB, there are sanctioned 30 leaves, but are you getting that in your institute? You should make sure that about that. In my institute, yeah, they give. Then DM, they are having different rules. Then, as I said earlier, you should be sure whether you want to do extra 1 year of bond. Then you choose institutes which are offering you DM. If you want more research, if you are more research oriented, you should go for DRNB. Sorry, because a thesis is mandatory for DRNB candidates, while it's not mandatory for DM candidates. Bond is mandatory for DM candidates. It's not there for DRNB candidates. Then you should prefer institute where less paperwork is there, and so that you can focus more. See, paperwork will be there, legal implications will be there, especially in your branch. And I would also say you should have that indemnity insurance with you, because nowadays so many legal cases are going on, and sometimes what happens is patient becomes or the relatives themselves, they become the Google doctors, and they try to question you at each and every point. And I see, this is my personal opinion, personal experience, that whenever this happens now, that time only, in those cases only, patient deteriorates more, because they question you at each and every point, and even you try to think that am I doing the correct thing, am I going wrong somewhere, and then your decision gets hampered. So that should not happen. And yeah, but that we cannot stop. But then you should have a good legal support from your institute. In government setups, obviously, we see a patient of different socioeconomic strata. So these legal implications are less in our country. So if you're opting for DM, these implications won't be there. Then yeah, also while you are choosing the institute, you should see whether it's a tier 1 city or tier 2, tier 3 city. As I said, in tier 1 city, you will get to see more complicated cases. In tier 2 or 3 cities, you will get to see more of poisoning cases. So this varied clinical exposure is there. But then definitely I would say, to have a good work-life balance, you should choose a city which is nearer to your home, or maybe maybe your native place would be better, because at this point of your life, it's very important to give time to your near ones. And definitely that emotional burst out which happens, that time your family members will be there to help you out. Then you should also confirm what are the accommodation facilities are being provided, especially in the DRNB institute. Sometimes they don't provide. Sometimes they will say that, yeah, we will give you extra stipend, but we won't be providing. Then while choosing the city of your institute, also see whether it is safe for you or not. Safety as in it depends. It depends. Like in few cities, you cannot be assured, rest assured that, because in night shifts you have to go. Specifically, if I talk of the female gender, we will discuss that later. So safety wise also you should choose the city. Like, I'm not boasting, but yes, Mumbai is one of the city which is good in terms of safety, even in the night hours. So that is one thing. Then yeah, the department toxicity, you should inquire about that, because what happens if your department is not supportive, definitely you will at some point of your residency have that you will have that burst out, or you will say that I don't want to pursue it anymore. So and I am lucky that my department is very good. They are very supportive, and they like organize extracurricular or what we say fun activities sometimes, maybe outings with the resident doctors. So these all things are very important in critical care medicine department. And your seniors should be supportive, is what I wanted to say. So all these things are there. Otherwise, I know this is one of the important questions, and the listeners would like to have more insights on this. So definitely you can share my contact number towards the end of this session, so they can go through it. They can ask me questions later on regarding this.
Okay, perfect. So I will share. And also, like, top of your head, you mentioned like so many points about how you should choose an institute. So top of your head, which institutes, I'm sure a lot of people would like to know this, but which institutes would you say would be really ideal? I know you won't get everything at an institute, but which institutes would you recommend?
Yeah, so like, it's a very personal opinions. Like for DM, see, this is a very new and emerging branch, but then there are certain government setups which are offering DM since long, like CMC Vellore is there, then AIMS Delhi is there, then Tata Institute is there. But every institute is having their pros and cons. Like Tata is specifically seeing the cancer patients and more focused on that. Then I don't want to go into the details, but these things are there. Then in DrNB, definitely there are various hospitals, private hospitals which are well recognized. The Medanta one in Delhi, then Apollo in Chennai, Bangalore. Various hospitals are there in Mumbai. Prominent hospitals like Hinduja, JAslok, then Jupiter, Thane. And because I am from Maharashtra, so I know more about the institutes and colleges in Maharashtra. But yeah, Delhi, for the Delhi institutes, if any of the listeners want the preferences, I can go through it and see. In my days, I have selected Delhi institutes also. But then now every year things changed. So then in Pune, Dhinanath is there. So yeah, South institutes, like specifically in Kerala, Bangalore, Chennai, there are various institutes which are good. So every year the things change, and yeah, I we need to discuss. I would like to tell this to the aspirants, that you first discuss these things with the trainees who are there in that institute, because sometimes what happens is there's a what we say, there is a fake news which is going on, or since many years we say that yeah, these institutes are very good, but then when you actually do training in those institutes, you realize, no, yeah, this is not that great. Because one of my friend, uh, I would say the name of that institute. He went there, did 6 months of regular registrar posting, and then he realized that it's just a name.
Mm.
But the practically speaking, or in real life experience, he found that other institutes are better than those. So with this, I would like to say that now is not the time, but if counseling takes more time, and if there are number of cases like we see in these days, And if you have time, so for 1 month or 2 month, you should go and do a plain registrar posting in that particular institute, mainly in private hospitals if you want. In the government setups, there are limited seats and limited hospitals, so you will get to know about the information about that hospital pretty easily. But for the private setups, if you want, if you're eyeing a specific institute, you should go and check there. I know there is less time now, but then that's required. And as I said, there are pros and cons of each and every institute. It's not that this is the best one or this is. See, there are certain institutes which are recognized ones, but then I cannot say that this is the best or this is having the 100% or this is offering the 100%. Yeah.
Right. Right. So yeah, no institute is perfect, and we can only do our best to take the best from
Yeah,
it.
it is you who will decide how your career is. Even a person from a tier 3 city can have a good future, or even a person who has pursued from the top institute. Sometimes, they sometimes change the profession, and also it's a very like I should not mention, but then yeah, sometimes they also decide to end their own life, which is very common in our medical profession. As I said, it's not the institute. It depends on you and your this thing, how you are reacting to the situations.
Right, right. And we always aim to focus on the best. So, well, my next question is, when it comes to an aspirant choosing this field, which personality types would you suggest would fit into this profession, and which personality types wouldn't fit into this profession?
Okay. So as I said that, yeah, people might say that, yeah, you need a type A personality
Mm,
to practice in critical care. But then I would say that you should be having quick response with a calm mind. Because
mm,
if you're having quick response and that response is associated with what we say, like if you are not calm, so definitely you might do something wrong. And you should be having a good team approach, specifically if you are going for code blue. Code blue is a thing I think many of the aspirants might be knowing. When any patient lands into cardiac arrest, code blue is announced in that particular institute. I don't know, I'm not sure about the government institutes, but definitely it's there in the DrNB setups. So that time you are the leader of the team. It's you are having people from medicine department, also anesthesia department, also nursing department, then the workers and the helpers, but you are the leader of the team. So at that time, what thing is to be done? Yeah, there are ACLS protocols which we follow, but it is you who is following those protocols. So you should be having calm mind, and you should calm mind doesn't means that you should take time to respond. You should be quick but with calm mind. And
mm,
if you want if you want less hours of working, less stressful life, or more of OPD cases, you prefer more of OPD cases, then you should not, I would say, you should not opt for the critical care branch, because it is a branch which requires person with quick responses and a dedicated approach. And
mm,
yes, a good emotional quotient
mm.
should be there. You should be emotionally mature to handle critical cases and the counseling part.
Okay. So, in summary, a calm mind and someone who's a leader who's able to guide everyone in the team. And okay, so well, when it comes to your next step, how the financial aspects and the career aspects of your field, what is the expected earning trajectory during residency, shortly after, and later on, once you become established? What is the trajectory of your career?
Yeah, so in the residency, mainly every state and every institute, like in the DM institutes, as far as I know, in Maharashtra, 90,000 to 1 lakh per month is there for the residents. This is a question of debate in entire, like all the what we say teaching institutes, that yeah, in India you are getting lesser pay for each and every branch, each and every resident doctor. The amount of work which they are and the amount of time which they are giving for their country, they definitely deserve more. But then this is the fact. This is the reality, harsh reality, I would say. They get approximately 90,000 to 1 lakh in the DM institutes. It might vary as per the state, but in Maharashtra, yes, you get that. And the DNB institutes, they have a rule that that particular DRNB institute must pay their residents at least the stipend which has been sanctioned by the state government of that state. So here in Mumbai, we get the similar pay as a resident doctor working in JJ will get. So similarly in Delhi, they will get similar pay as a resident doctor in RML is getting. So that is the minimum. The private hospitals, they can additionally pay, and in many institutes they give you a bonus. What we say, pay many a times. Sometimes what happens is they will say that we can't give you accommodation, you just take extra pay. So all those things are there. This is the residency part in tier 1 city. What happens is anyway, but that is a different aspect. But then this is the residency part. But once you clear your degree and you have degree, then definitely it increases drastically. Maybe a post 3-year degree holder will be appointed as an intensivist. In tier 1 cities, what happens is you must have that 3 years, at least 2 to 3 years of experience. Then only they make you intensivist or give you that post. Then in tier 2, 3 or 3 cities, sometimes the fellowship holders are also given that rank, or the what we say, they are appointed at that rank, and they might get. So as I said, in tier 1 you should be having a good degree, and in upcoming 3 years you can get the post of intensivist. You can earn from 2.5 to 5 lakhs depending on your skills, and depending on how you bargain with the corporate hospitals. In government setup, everything is fixed. As the state government is involved, you get lesser pay in the initial stages, but you get regular promotions and regular add-ons in your pay. So yeah, you can definitely earn in the upcoming 5 to 10 years. Things might change because it is an emerging branch, but easily you will earn in the after 3 years you can easily earn 3 to 4 lakhs, as I said. And after that it keeps on increasing as you reach that level of consultancy. And it also depends how your freelancing have practices, how your network is. If you're getting good opportunities in the freelancing, you can get affiliated to different ICUs in the same city. So yeah, it's financially but I would say don't go behind monetary benefits. Get a good work-life balance, because ultimately we are earning for ourselves. Yeah.
Okay, so well, that's a lot to take in, and well, after doing so much, so many exams, giving so many exams, doing so much of training, how much free time do you get as a resident, and do residents get in general? And do you get time to pursue your hobbies and for travel and your managing your family life?
Yeah, so it, as I said earlier, it depends on your institute. You should be very specific while selecting your institute. Are they giving you the number of sanctioned leaves?
Mm.
Specifically in DNB, there is a very stringent criteria that each and every DRNB candidate must get 30 days of leave. So if you're getting that, if you're getting additional, what we say, weekly offs, like in my institute, they sometimes, if we are 4 people in one ICU, so we get 48 hours a week. So one off extra is you're getting, and that you can dedicate to your own time. Yeah, definitely you have academics. You sometimes, maybe in the third year you are more focused on studies, but in maybe in second year of your residency, you can dedicate that time for your own. And as I said, emotional well-being is very important in this branch. So definitely you should travel at least once in your and once in 1 year at least. You should dedicate time to your family members. You should go home once if you're getting these leaves sanctioned by your department. Then sometimes what happens is, you in the corporate setups, you're the only one in the ICU, and if any of your co or your reliever or the person who is going to relieve you gets sick, so that time maybe the work life balance is a bit affected. But that is for a very short duration. But yes, you get time. It's not that you won't be getting time, but you should be very careful while selecting your institutes. You should inquire everything. You should talk with the DrNB residents over there. Are they getting time? Are they getting leaves? And as I said, when you are getting those 24 hours of a gap between the two shifts, many a times you get in most of the institutes. In some Delhi hospitals, I've heard that sometimes they call in between of that in those 24 hours also. So it depends. If you are very passionate and if you want to like have a good clinical exposure, you're I would say, if you are not married and you are more focused on your this aspect of life, so you can choose that. But then you should be like, it depends on you. So yeah,
Mhm.
you get time.
Okay. So after all of this, after you've completed your super specialization as well and doing completing your DNB, how many years on an average does it take to reach a point, a stable point in your career where you can say, okay, now I can just continue my practice and I am at a point where I don't have to worry so much about, studying more or doing more. How many years or how does it take to establish?
I was saying that like in tier 2 or 3 cities, even 1 year of fellowship, or even your specialty in tier 3 cities, even if you have done just MD General Medicine, MD Anesthesiology, you can be the in charge of the ICU. In tier 2 cities, even the fellowships will work. Or initially there was this FNB. Before the DNB has started the DrNB course, there was a FNB course of 2 years. So these FNBs and what I was saying, that these fellowship courses of IDCCM, and they can have a good rank, sorry, good post in tier 2 cities, even after 1 year, even after 2 years. In tier 1 cities, yeah, nowadays they are going more towards the degree holders, as I have said, and in upcoming 5 to 10 years, they will focus more on that. So I would say that post 3 years of your clinical training, definitely you can start your junior consultancy. Then later on, after 5 to 6 years of your training, you can become an established consultant. It depends how your network is and how the people see you as a clinician, and how much they respect your advices. So it depends, but generally in 5 years you reach that point that yeah, you can become a consultant. Five years after you have started the training,
Hmm.
specifically a degree training, I would say. So that's the thing. But
Okay.
yeah, I would suggest that please finish off your bonds. Like MD, various MD institutes are having 1 year, 2 year bonds. So just finish it off prior to this, because in the critical care specialties, various specialties are there. So suppose you're from anesthesia background and you have done 3 years of critical care, and then you think of completing the bond. You don't have critical care departments in various government institutes, so you will have to work as an anesthetist and then complete the bond of 1 year. You will get that gap of 1 year after your degree of critical care. So just finish off your bond and then join.
Okay. So the differences between Tier 1, 2, 3 uh, changes your career path as to how much time it will take to establish. So then coming to the next question, moving away from the career aspect, when it comes to the academic aspect, are there a lot of opportunities for research in this field?
Yeah, definitely, because this is a new field, and there are various journals with there are different societies, like Indian Society of Critical Care Medicine is there. European society is there. Every country, Australia is having their own society. Middle East is having their own society. So they have their own journals. So you can publish your literature. In DNB, definitely you will have to do a thesis. So and there is a lot of scope of research in critical care, because there are new things which are coming out, and you need to be sure before applying those things in your real life. Then conferences also are there. Annual conferences of ISCCM is there every year. State conferences are there. You should be visiting these, like register. You should register for these conferences. Should register for workshops. You should be like in medical profession. We say you are always a student. So definitely.
Okay. And which organizations are like very relevant to critical care medicine, especially in India? Or
Yeah,
all?
yeah. So Indian Society of Critical Care Medicine, you should become a member very soon as you enter there. And I think for the IDCCM candidates, it's mandatory. But as a DRNB candidate, also you should register there. Then, if you're giving EDIC along with this DNB, then ESCCM European Society, you should register for. So it depends on you. But yeah, you should definitely go for their membership. Also, you should be engaged in extracurricular. If you get time, you should also be engaged in extracurricular activities, and you can offer other organizations like Indian Medical Association is there, who help you out in your future life. Actually, I missed this part when you asked me about my hobbies and work-life balance. So I can say that even in spite of being in critical care medicine branch, I am able to carry out my activities. I'm also on having a post in Indian Medical Association's official wings. So I am able to carry out those activities as well, along with my DNB course. So definitely you get time for that. So these extracurricular things are also there. So these organizations also you should be involved in.
Okay. So, when it comes to the near futures, as time changes, what advancements do you foresee in critical care medicine in the next 5 to 10 years? And how does AI and point of care technology, how do all of these things change the course of this field?
Yeah, so there are different researches going on in various countries like US, then China, India also. Various researches are going on. There are predictive AIs, there are actionable AIs on which researches are going on. Then there are these things like hypotension prediction index. Then you can predict sepsis beforehand. Before, like I said, HPI, you can predict that this patient will land into hypotension in maybe after few hours. So this is there. Actionable AI, there are very minimal studies and minimal setups. Specifically in India, we don't have so much of AIs and AI aided services in Indian setup. So maybe in the near future, like they are working on bioartificial liver, they are working on Mars project. The full form of Mars is there. So all these things are there. But yeah, definitely this is the future. It will take at least 10, 12 years in India, specifically in Indian setup. Researches are going on. It will take time, but
Mm.
definitely see, in critical care, intervention is the key, and I like minimal interventions can be provided by AI, but if you have to secure an arterial line, I don't know, will the AI be able to do that? Will the patients be safe? So there are various ethical and legal aspects involved. It will take time.
Mm. So AI mostly will help with maybe diagnostics or predicting some
Yeah,
parameters. But
initially initially researchers will be focused on the predictive part.
mm, okay. So coming to my next question, if aspirants are interested in going abroad outside of India, what are the global opportunities for intensivists who are trained in India? And are there different certification requirements to apply abroad? So if so, then which ones are required?
So you should be definitely having the degree, like DNB or DM. I would say more preferred over IDCCM or fellowships. And then you should be having fellowship of that particular country where you want to practice. Like in Europe, European diploma, you can have EDIC degree, fellowship, this thing certification course. You should you should clear both the exams of EDIC 1 and EDIC 2. Then Australia has their own fellowship course. You should clear that if you want to practice in Australia. USA is having different thing. Middle East is having different fellowship. So you should be apart from the degree which you have gained in India, you need to clear those fellowship exams which they have specified if you want to practice abroad. But definitely you can have networks all over. You can attend the online webinars which they are conducting. You get to learn more newer perspectives from the different countries, that how they are treating this condition. And in my institute, they organize lectures from the international faculties also sometimes. So how they see sepsis, how they see gram-negative sepsis, or how they approach the patient, what all different antibiotics they use, what are different treatment options they have. So definitely what I would say is, apart from the fellowships, you should be engaged in these kind of webinars when you are gaining the knowledge. But yeah, as I said, fellowship is mandatory if you want to practice in that particular country.
Okay. Okay. So, as you mentioned in the beginning, that Mumbai, like even I studied in Bombay, so I know it's an extremely safe city for females. So, when it comes to the branch of critical care medicine, are there any gender specific challenges or advantages or disadvantages like in pursuing this specialty?
See, apart from this safety issue, I don't feel so anything is there, because both the genders are all the genders are working equally in this field. And everyone, it depends on how, as I said earlier, how your personality is. It depends totally on that, how you're responding, quick responses, calm mind, leadership skills. It depends totally on that. Apart from safety issues, I don't think so. Safety issues, why I'm saying it, because you are having more night shifts in this particular branch, even in your consultancy phase. Like there are so many female consultants who are working in the night shifts, as I see in critical care, which I don't think so in other super specialty. After maybe 3-4 years, even if you are not in government setup, in corporate, I don't think so they will opt for night shifts in other super specialty. But in critical care, you definitely need to go through that training part in the night shifts. So I don't think so, apart from safety, any other issues there.
Okay. So, well, perfect. And lastly, are there any final messages that you would like to share about critical care medicine with the aspirants, current aspirants, and future aspirants as well?
Yeah, so yeah, as I said, every second matters. So in critical care, so you should be prepared for the worst in scenarios. And every see, what happens is, whenever I go on duty, it's like like a war. I'm not I might not be using a perfect word, but then it's like a war that you go there, you have you are mentally prepared that now I might see these scenarios. But then there are lot many surprises which are happening. You might think that this patient is stable, or this patient is bad, but reverse happens. Sometimes a stable looking patient can land into something else, and complications are there. So you should be well prepared. And as I said, that you should be very what we say, your observing skills should be there, anticipating skills should be good. You should be able to anticipate then that this particular patient might land into trouble. If you anticipate well, if you have a quick response, it's not so that if you have anticipated but you're not taking action on this. I remember one of my consultant used to say, you have noticed this, but have you taken any action on this? Then what is the use of noticing that particular point? So
Mm,
you should be having that quick response.
right. Well, so with that, I would like to conclude the meeting. And again, thank you for your time. And it was very knowledgeable. I did not know that so many things does exist. And this was a very knowledgeable session and a wonderful session. So to view the field of critical care from your lens and your perspective. So we are very grateful to have you here. And thank you.
Yeah. So thank you so much everyone for those who have joined. Also, I hope that we will be sharing the video, the recorded one, with all our candidates. And then I would like to just mention one thing before we stop. That before we conclude, that at the end of your duty, you should be having that sense of satisfaction that whatever I have done, even if you're getting scolded from your seniors, see, scoldings are there for your benefit. So some level of toxicity is okay in our profession. Some level, I'm saying, not the entirely. But then, even if you are getting scolded, but you should be having that sense of satisfaction. Whatever I did for all my patients today, it was good, and so that you will get a good sound sleep and you will have a good health. And when these patients, see, many of the times we are busy in patients who are in the end stages of their life or end of life care, there maybe 30-40% times or 50% times, but when the rest of them, the patients who get recovered, or if you have acted swiftly, and if they are saved from the danger, and that particular time you get that satisfaction. So that is the key which motivates you and drives you to continue to pursue this branch. So just be focused, and just have that passion towards critical care, and definitely you will succeed and become a very good critical care specialist, intensivist in your future lives. So thank you. That was the message. And as I can see, my number has been shared already. So if any doubts, we can have that. Thank you so much, the team of KYC, and thank you so much, the area and Ritika, for organizing this. Thank you.
Yeah, thanks a lot. And we will wait for another 15 seconds if there's any of them have any doubts. We can. So yeah, someone's typing. Perfect. So and yeah, thanks a lot. And further, I would like to extend an invitation to anyone interested in joining our team. Know Your Calling. Please feel free to join, and you can message Dr. Dhairya on LinkedIn, and you can directly join the session. So thank you everyone for staying throughout the session, and thank you, Dr. Akshay, as well, for giving so many insights. Thank you. It was a great.
Thank you.
Yeah. Perfect.